Hello and Namaste. Welcome back to Fabulous Body. I'm Akash, your holistic nutrition coach. Today, we are tackling a topic that affects millions of people worldwide: acid reflux, heartburn, and GERD. Now, have you ever felt that burning sensation in your chest after a big meal or a late night snack? If you know the feeling, this video is for you. Now, it's estimated that 60 million Americans experience heartburn at least once a month. And according to an article in the Times of India, around 20 to 30% of the Indian population suffers from GERD or gastroesophageal reflux disease. Now, before we dive in, let's clear up what acid reflux, heartburn, and GERD actually mean. Then we'll get to the root causes of these issues and wrap things up with around 13 holistic natural remedies that can help relieve or even stop reflux from happening. So let's start with a quick look at how digestion works. So the process begins in your mouth, where food is chewed and mixed with saliva. The food, when travels down your esophagus, also known as the food pipe, the esophagus has two important walls, also called sphincters. The upper esophageal sphincter, also known as UES, opens when you swallow to allow food to pass. The lower esophageal sphincter, less, it's also called the cardiac sphincter, is the key player here. It's located where your esophagus meets your stomach and is responsible for keeping stomach acid from flowing back up into the esophagus. Once food reaches your stomach, powerful stomach acid with a pH of about 2 is released along with pepsinogen to help digest protein, intrinsic factor for vitamin B12, and a lot of mucus to protect your stomach lining from the hydrochloric acid. Now, the problem starts when the lower esophageal sphincter weakens or doesn't function properly. This can cause the contents of your stomach, including the acid, to flow back up into your esophagus, which is your food pipe. Unlike your stomach, your esophagus does not have a protective mucus lining, so this acid causes irritation, resulting in that burning sensation, what we call heartburn. If you experience acid reflux more than twice a week, it's likely GERD. The full form of GERD is gastroesophageal reflux disease. This is a more chronic form of acid reflux that can lead to serious complications if left untreated. So let's try and understand what causes the acid to escape the stomach. The issue isn't the acid itself, but the conditions that allow it to flow upwards. So here are the main causes. First is that the lower esophageal sphincter dysfunction. The less should close tightly after food passes into your stomach, but in people with GERD, the less weakens or relaxes at the wrong times. This allows the stomach acid to reflux into the esophagus. Second are dietary triggers. Some food and drinks can relax the less or increase acid production. Common culprits include spicy, fatty, or acidic foods. There's caffeine, alcohol, chocolate, mint, and carbonated beverages like soft drinks and energy drinks. Third are lifestyle factors. Eating larger meals or lying down too soon after eating. Smoking, which also weakens the less. Tight clothing that puts pressure on your abdomen. Then there are medications. Certain medications can contribute to reflux by lowering the less pressure or irritating the esophagus, such as calcium channel blockers, NSAIDs, antihistamines, and antidepressants. And lastly, genetics do also play a role. GERD may run in families due to inherited conditions that affect the digestive system. Now that you have understood the root causes of acid reflux, heartburn, and GERD, let's look at 13 simple, effective, natural remedies that can help you find relief. Okay, so the first category is dietary modifications. Changing what and how you eat can make a big difference. The number one thing is to avoid trigger foods. Identify your personal triggers like spicy or fatty foods, chocolate, caffeine, and alcohol. Keep a diary with you. Write down how you feel 30 minutes after eating a meal or a particular food. Second is eat smaller meals. Large meals can increase stomach pressure. Try 4 to 5 smaller meals throughout the day. Third one, this is very important. Avoid eating near bedtime. Ideally, eat no calories post sunset to give your digestive system a break and leave a gap of at least 4 to 5 hours before your last meal and your bedtime. Then moving on, chew thoroughly. This helps with digestion and reduces the workload on your stomach. Then increase fiber. Eating fiber-rich foods like vegetables, fruits, and whole grains can prevent constipation, which can worsen reflux. Now, second category has to do with lifestyle changes. Simple lifestyle tweaks can significantly reduce acid reflux. Start by maintaining a healthy weight because excessive weight puts pressure on your abdomen, making reflux more likely. There is visceral fat, which is the fat surrounding your organs. It needs to go down. Maintain a low body fat and this acid reflux issue will be drastically reduced. I've seen it in my clients firsthand. Reduce your body fat, especially your visceral fat. Quit smoking. Smoking weakens the legs, leading to more reflux. Then elevate your head while sleeping. You can use a veg pillow or raise the head of your bed to prevent nighttime reflux. Then you can wear loose fitting clothes. Tight fitting around your abdomen can worsen symptoms. Then moving on, manage stress. Stress can increase stomach acid production. Practice mindful eating. Avoid distractions like watching TV while eating. Then the last category focuses on herbal remedies. Certain herbs can soothe reflux symptoms. First is my favorite, ginger. Known for its anti-inflammatory properties, ginger is a powerful herb that can help with acid reflux. Try ginger tea or even chew on a small piece of fresh ginger. Licorice roots. Licorice increases mucus production, which protects the esophagus. You can take licorice capsules before meals or buy it in natural form and simply chew on it. Last but not the least, chamomile tea. This tea helps reduce stomach acid and can relieve stress. Drink it 30 to 60 minutes before bedtime. Right. There you have it, a deep dive into acid reflux, heartburn and GERD along with 13 natural remedies that you can try. Remember, small changes can make a big difference. If you want to learn more about your digestive health or your gut health, check out my gut health playlist. Remember, when you master the fundamentals is when you get advanced. Stay healthy, stay fabulous.